Professor Ayyappan, members of the Karnataka Science and Technology Academy, ladies and gentlemen, at the outset, I express my sincere gratitude to Professor Ayyappan for inviting me for this lecture held under Bharata Swatantra Amruta Mahotsava lecture. So I have selected a topic which itself is very relevant in the country because the condition itself is increasing day by day. Patient in an unknown world. The malady de Alzheimer is a condition which I am going to refer. Memory lapse, particularly it is rising in elderly population globally, including India. The condition itself is commonly associated with the disorders affecting heart, lungs, kidney, diabetes, osteoarthritis, blindness, deafness, cancer. All these conditions quite often are being encountered in elderly individuals. And the memory lapse itself is very common, and the condition is itself, many of us attribute it to the old age, and old age itself masks the onset of dementia. And it affects nearly 6% of the people aged 65 and above. The dementia in India itself, the number is quite staggering. 4.5 million people are suffering from that. This number itself is second most number suffering in the world. And this is taken from the Dementia India records. And the condition itself is likely to double by 2035. And the highest number of people suffering from dementia are encountered in Maharashtra and Uttar Pradesh. The point is the condition, there is a delay in diagnosis. More than 25% of the patients remain undetected. Often, the memory loss itself is equated to the Alzheimer's disease, both of them, and it is a neurocognitive disorder. It is a dementia, how we are going to define. It is a syndrome caused by disease of the brain, usually of a chronic or progressive nature, in which there is disturbances of the multiple higher cortical functions, including memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Latin itself is come, the word has come. D means out from, and mens is mind. In our country, we refer Smriti Bhramsha. The Alois Alzheimer in Frankfurt, Germany, in 1907, encountered a patient called Augustine, aged 52 years. This lady had presented with progressive memory loss and disorientation. And this disorientation itself progressed in course of 4 years. The patient became incontinent, incoherent, and immobile. And she later died from this particular disorder. When an autopsy performed on this particular patient, the brain itself showed a large number of neurofibril tangles and senile plaques. And the condition was thought to be dementia. September 21st itself, all over the world, we celebrate the World Alzheimer's Day. Alzheimer's disease itself carries with it the significant economic and social costs because the population is aging in all over the world. And this itself fact puts additional pressures on the limited resources available to tackle the condition. Women are worst affected due to higher life expectancies and ill health and disabilities. Because of their longevity, definitely they are some more suffering more compared to the men. And you can remember this particular lady, Margaret Thatcher, the British Prime Minister. Another British Prime Minister, the Harold Wilson, George Fernandez in our country. This is Rita Hayworth, the film artist. This is the important actor Charles Heston, who performed this one in 10 Commandments. All these individuals suffered from this particular condition. Charles Colton, in 1792, he made a statement. Body and mind, like husband and wife, they do not always agree to die together. Brain dies before the body. Still, it is intriguing why brain dies before the body in this devastating illness. And this condition can strike rich or poor, famous or unknown. This is a progressive and fatal neurodegenerative disorder that gradually steals the cognitive functions in elderly. There is mental deterioration with loss of intellectual abilities to interfere with social and occupational function. And there is atrophy of the cerebral cortex and the hippocampus. The intraneuronal neurofibril tangles, they are present in large amount in the brain. They contain abnormally phosphorylated tau protein, and there is presence of extracellular amyloid plaques, and there is neuronal cell death that is responsible for this particular disorder. And there is progressive impairment of activities of the daily living of the individual. The manifestations, there are wide variety. There are neuropsychiatric symptoms, behavioral disturbances. There is gradual impairment of memory. And this particular disorder forms the leading cause of dementia over the age of 65 years. And the Alzheimer's disease itself accounts for 50 to 70% of all dementias. And this is progressive impairment in both cognitive and the functional capacities. There is a loss of the intellectual abilities of sufficient severity, which itself causes interfere with the social and occupational functioning of the individual. In our own study, when we performed, there the incidences of both male and female, it was equal. The incidence was greater in the age group of 61 and 70 years and 71 and 80 years. So this disease itself is a condition noted in advancing years. What is the cause of this particular condition? When we ask this particular question, the answer itself is very difficult because the cause itself is undetermined. We think that the advancing age is responsible, or is there any genetic predisposition or environmental factors are playing a role in the development of this particular disorder. The incidence increases with each decade of life. The prevalence, it shows an increase in the coming years as more and more people live to advanced age. India itself is a graying country, often we say. Nearly 10% of the people are belonging to this age group. So their number is going to increase year after year. So definitely this condition puts an enormous burden on the patient, on the family, and the caregivers. So there is also a genetic basis for this particular condition. There is a positive family history as a genetic basis. There is a genetic predisposition causing early onset of the disease. It's only in those, there are the instances where the disease has been noted in 30 years, 40 years, 50 years, like that. So there is a genetic predisposition causing early onset of the disease, which itself is inherited as autosomal dominant trait with relatively complete penetrance. So there are 4 different genes which are involved in this heritable form of disease. Which are they? The one was apolipoprotein E4 allele on the long arm of the chromosome 19. It increases the likelihood of the Alzheimer's disease and increases enhanced amyloid beta peptide aggregation or decreased cleavage. Down syndrome is another important condition. More than 30 years when they live, there is a progressive dementia is likely to happen. Chromosome 21, it harbors a gene which is responsible for the pathological changes similar to that of Alzheimer's disease in them. And there are mutations in the presenilin 1 gene on the chromosome 14. There is an early onset of the autosomal dominant Alzheimer's disease. And there are also mutations on presenilin 2 gene on the chromosome 1. In these instances, similar to the mutation encountered in the gene on the chromosome 14, there is also early onset of the disease. The condition is shorter duration. It is a more rapidly progressive course than the disease which is caused by the mutations of the presenilin 1. So the condition which we are talking, there are many risk factors, though they are not totally validated, but we also should consider these factors were responsible for the onset of this particular disease. Advancing age, female gender, head injury, low serum folate and vitamin B12 levels, raised plasma homocysteine, family history of Alzheimer's disease or dementia, higher socioeconomic status. Note this, because quite often whenever we think of disease of lower socioeconomic status, there is a condition where we mention higher socioeconomic status. Isolation, estrogen deficiency, exposure to aluminum, depression, and other risk factors are vascular disease, smoking, high blood pressure, high cholesterol levels, sleep disorders, genetic predisposition with apolipoprotein E gene. So you find there are a large number of risk factors. It is very difficult to pinpoint any one particular factor is likely to cause this particular disease. And this is a memory destroying illness. The sensory experience, which in our life we encounter, they are all processed and stored as memory in the brain. Information can be recalled in an integrated fashion at appropriate time. So now we are giving a lecture. We know this particular day, this lecture is organized. So we are getting prepared. So the thing itself is recorded in the brain. So the memory itself fades in Alzheimer's disease like an eraser of the computer hard disk. Suppose one click, whole thing itself is there. We can't get back. Recent memory and later old memory, they are being lost. Last learned, first lost. So recent memory itself is the one, and later old memory. So quite often people will be recalling that, oh, that lady, where is she? That house in that particular lane, like that they will be talking. So there is an inability to recognize near and dear. This is the most difficult thing. They can't recognize who you are. Even though you may be your spouse, he can't recognize, he can't tell the name. There is a loss of lifetime memories and the loss of identity. This is the most worst disease. So you find there are diffuse plaques which are being present in the cerebral cortex. This immunohistochemistry, this is how the diffuse plaques are being distributed in the brain one can encounter. And there is also presence of the phosphorylated tau protein in the brain. That is an accumulation of tau protein. And again, you find the same thing which is being found in the form of neurofibril tangles in the brain. And the neurofibril tangles, again, they are being seen in the brain, which is being shown. So there is a progressive loss of the cortical neurons in the brain. We find there are more than 100 billion and 100 trillion associated connections. There is a formation of the amyloid plaques, intranuclear neurofibril tangles. That is the most important pathological change. There is a large accumulation of the amyloid plaques where they are being distributed as intraneuronal neurofibril tangles. There is accumulation of a beta amyloid in the arterial walls of the cerebral vessels. That's why many people tell whether it is a vascular disease. So beta amyloid forms a major component of the plaques. Hyperphosphorylated tau, it's a microtubule associated protein. These two are the most important constituents of the neurofibril tangles. Presence of a large amount of beta amyloid and presence of hyperphosphorylated tau proteins. So there is an atrophy of the brain which begins in the hippocampus, and then it spreads to involve diffuse areas in the temporal, parietal, and the frontal lobes of the cerebral cortex. There is a symmetric enlargement of the third and fourth ventricles. There is loss of neurons in the nucleus basis. There is a relative deficiency of acetylcholine. This one important chemical which we use for the treatment. So there is a relative deficiency of acetylcholine in the neurons. So you find the cross-sectional brain of a 73-year aged patient, you find there is a generalized atrophy of the brain, and the ventricles themselves are being increased, enlarged in their size. So healthy brain you find on one side, severely affected from the Alzheimer's disease you find on the other side. Here, in the preclinical stage, then the disease itself, when it is mild to moderate and in the severe, how the brain itself becomes atrophied and the ventricles are increasing in their size. So there is a cascade of events pertaining to amyloid. They underlie the development of the Alzheimer's disease. The condition is initiated from production of the beta amyloid peptide from the amyloid precursor protein by the enzymes beta and gamma secretase. So the condition is initiated from the production of the beta amyloid peptide. So this beta amyloid peptide, it progresses through oxidation and lipid peroxidation of the cell membranes. There is a glutamatic excitotoxicity, beta amyloid aggregation, the inflammation, tau hyperphosphorylation. All these pathological changes are taking place in the brain. So this results in neurotoxicity, neuronal cell death, neurotransmitter deficit, because through the chemicals only, the brain transmits the messages. So these three important changes that take place: neurotoxicity, neuronal cell death, neurotransmitter deficit. So when we are thinking of the treatment, we quite often use a choline esterase inhibitor because acetylcholine is necessary for clear thinking. So there is this acetylcholine itself is destroyed by the acetylcholine esterase. So in other words, in Alzheimer's disease, there is a deficiency of acetylcholine chemical. So the choline esterase inhibitors, which are used to block the action of choline esterase to increase the cerebral concentration of the acetylcholine, which itself is essential for the transmission, synaptic transmission, the bridge where this chemical transmits the message. So when we administer this choline esterase inhibitors, it causes an improvement in the global function. It reduces the cognitive disturbances. There is another agent called memantine. The symptoms of the Alzheimer's disease have been thought to be due to the persistent activation of the central nervous system N-methyl D-aspartate receptors by the amino acid glutamate. So the glutamate itself is excitatory neurotransmitter substance. So the memantine itself is NMDA receptor antagonist, and the administration of the memantine slows the cognitive decline in mild to moderate Alzheimer's disease. So what are the clinical features which the individual presents? The condition makes a gradual beginning. There is functional and behavioral disturbances. There are multiple cognitive deficits, impaired memory, loss of orientation, deterioration of the languages, and inability to carry out the motor activities. So these are the manifestations. There is an inability to recognize and identify the object, plate, pencil, pen, TV, nothing they can't recognize. There's disturbance in the executive function, planning, organizing, sequencing, and aesthetic. All these faculties are being disturbed. They are not aware of the memory. There is a cognitive compromise. Immediate and recent memory. First to decline the immediate. What did you eat? Whether you eat idli or masala dosa or what, they can't tell. There is an apathy. They have no interest. And there is a reduction in the concern. Suppose you say that so-and-so died. He doesn't show any reaction. So there is no response from him. So there is personality changes, decreased judgment ability, aimless wandering. They move about in the house and the door is open. They go out in the street without any knowledge where he is going, who you are, what you are. If anybody asks, they can't answer and they will wander about. That's why many people have been lost. There is psychosis, mood disturbance, agitations, sleep abnormalities. These also can overlap. So there is difficulty to adjust with the changed environment. So because of that, these people require continued supervision by some caregivers. The advanced disease, they, the basic activities like toilet, eating, grooming, they're all being affected. So all these, they become dependent on the all activities of the daily living. There are the mood changes, apathy, agitation, psychosis, depression, delusions, behavioral disturbances, not motor. So they can move about. They are not bedridden, and the condition makes a progress. What are the early stage manifestations? What are the symptoms they will present? They find problems of talking properly. There is significant memory loss, which people near and dear, they can definitely recognize. They do not know the time of the day of the week. If they ask what the time, 9 o'clock, 10 o'clock, 11 o'clock, they can't tell. They become lost in the familiar places and they find difficulty to make decisions. They become inactive and unmotivated. There is mood changes. They may be depressed. They may exhibit anxiety. They have got loss of interest in the hobbies and activities, no interest in any activities. So they find you Alzheimer's disease. The top signs include memory loss, change in the mood, social withdrawal, poor judgment. These are the important some manifestations of the Alzheimer's disease. When the disease makes an advancement, they become very forgetful. They can no longer manage to live alone. They become extremely dependent on the family members and the caregivers. They need help with personal hygiene. There is increased difficulty with speech. There are problems with wandering and behavior problems. And the advanced stage, they have difficulty in eating. They are incapable of communication. They don't recognize the relatives and friends. They have difficulty in understanding. They are unable to find a way around in the house. They display inappropriate behavior in public. So they can't identify the place, where they are, what they are. In the public, they behave in an abnormal way. They react in a different way. And their behavior itself becomes inappropriate for the situation. So dementia and the Parkinson, there are other important things can set in. So all these things, okay. This dementia, most people with Parkinson's disease also develop dementia as a progression of the disease. From Parkinson's disease, they have difficulty to move about. They have slow movement. They are rigidity. They have got tremors. So in them, dementia also can overlap. So they have got again problems with cognitive function, including forgetfulness, trouble with concentration, and later they exhibit dementia. In Alzheimer's disease, there is progressive worsening of the Parkinsonism is more strongly associated with a cognitive decline. So how do we make a diagnosis? We have to eliminate other common causes of dementia. One of the most important is vascular condition affecting the blood vessels. So in that situation, dementia itself makes a sudden onset. Sometimes it can follow a cerebrovascular accident. They may complain other symptoms like headache, dizziness, and neurological deficits. And coexistent thyroid disorders, vitamin B12 deficiency are other important coexisting disorders which may be present in these individuals. Neuroimaging, particularly when the condition itself has been advanced, there is a new, when we take an MRI scan, we find there is hippocampal and cortical atrophy and enlargement of the ventricles. Cerebrospinal fluid, if we analyze, the plasma amyloid peptide is reduced and there is an increased tau protein in the cerebral fluid. The PET scan exhibits a decrease in the glucose metabolism in the parietal and the temporal lobes. In EEG itself is non-specific and there is slowing, and generally we say it is normal. The prognosis, the condition makes a very slow progress, loss of 3 to 4 points per year based on the mini mental state examination scale. We find they lose 3 to 4 points every year. They generally live for 8 to 10 years. So one of the patients who had suffered from this particular disease, the person who was attending, her description was like this: every day, a bit of life chips away. Little death occurs within the brain of the person with the disease. It takes away the very essence of life from its victims. It gnaws at life's little edges, leaving a void with uncertainty. So you find the brain which has been atrophied and the ventricles themselves have been dilated. So the normal older adults, low amyloid tau protein, you find normal older high amyloid tau protein, and Alzheimer's disease, high amyloid tau protein, we can find the increase in the amount of tau amyloid and also the tau protein. So normal, mild cognitive PET scan demonstrating that, and Alzheimer's disease, how the disease itself has become extensive. So they may die from septicemia, blood poisoning, pneumonia and upper respiratory infection, nutritional disorders, pressure sores, fractures and wounds. Some, there is steady downhill decline and a prolonged plateau without major deterioration. Some of them can also exhibit like that. So the treatment is the most difficult part in this particular disorder. However, our aim is to achieve an improvement of cognition, minimize disturbances in behavior like depression, agitation, anxiety, insomnia, psychosis, give support, administer cholinesterase inhibitors to halt the progression of the disease, administer antidepressants and psychotropic agents when there is a disturbances in the behavior of the person. Cholinesterase inhibitors, it forms a standard therapy for the mild to moderately severe Alzheimer's disease because it has been found there is a deficiency of this acetylcholine. So the cholinesterase, the acetylcholine, is metabolized by these enzymes. So inhibitors, they increase the cerebral concentration for the synaptic transmission. And earlier, one oral preparation called tacrine was used because it exhibited toxicity at the liver. Now it is rarely used. The other inhibitors, one of the common drug itself which is used, donepezil, the absorption of this particular drug is unaffected by the food. It has got longer serum half-life and a greater protein binding capacity. So 5 milligrams is administered once a day. Later the dose is increased to 10 milligrams once a day. Another important agent is rivastigmine, 1.5 milligrams twice a day, which is gradually increased to 6 milligrams twice a day. Galantamine is another preparation. To begin with, is administered in 4 milligrams and it is enhanced to 12 milligrams twice a day later. These cholinesterase inhibitors, they improve the global function, they reduce the cognitive disturbances and improve the cognitive functions. There is reduced behavioral disturbances. They are not responding to one class if individual, and they may show you response to the others. And there is no response if we administer this cholinesterase for 6 months continuously. And if the individual doesn't show any improvement, discontinue the treatment. The better effects themselves are seen in the early stage of disease when the destruction itself is minimal. Memantine is another important drug where the symptoms of the Alzheimer's disease, because of the persistent activation of the central nervous system, N-methyl D-aspartate receptors by the glutamate. So this memantine is an NMDA receptor antagonist. It has effects on some moderate to severe Alzheimer's disease. 5 milligrams once a day began with, increased to 5 to 10 milligrams. Then the dose itself is increased to 10 milligrams twice a day, and food itself is not having any effect. The individual may show cognitive improvement, and it can reduce the decline in the activities of the daily living. So this drug itself is well tolerated, not affect the inhibition of the acetylcholinesterase, the cholinesterase inhibitors. The tolerability itself is not affected with the donepezil or other agents. So sometimes it can cause confusion, headache, diarrhea, myasthenia, fatigue, bradycardia as the side effects. Antioxidants, quite often we are now, they talk everyday antioxidants. During excitotoxicity, There's an increased amount of calcium which enters the neurons, which activate the enzymes that produce the free radicals and cause destruction of the cells. They slow the decline by limiting the phosphorylation of the tau protein. Alpha tocopherol, one is used in 1,000 international units twice a day, or selezilin 5 to 10 milligrams in the morning to counteract the increased free radical formation, and has failed, however, after administration to improve the cognition. Hormones and anti-inflammatory agents have been tried because estrogen deficiency, one of the risk factors I told, estrogen replacement and the non-steroidal anti-inflammatory drugs and also the corticosteroids are also have been used, but they have not shown any success in the condition. Then the antipsychotics and mood stabilizers, because there are behavioral disturbances and neuropsychiatric symptoms, they are very common in Alzheimer's disease, and it can be controlled by the antipsychotics like risperidone or olanzapine to improve the mood. Mood stabilizers like carbamazepine, it reduces the behavioral disturbance and agitation shown by the patient, or sertraline as an antidepressant can also be used along with the other drugs. So the psychotic manifestations are in the form of agitation, aggression, delusion, hallucination. They can be common disabling symptoms. So the treatment includes second generation antipsychotic medication. These antipsychotic medication includes risperidone, olanzapine, quetiapine. With drugs, people experience increased risk of death, and still we continue to prescribe without any evidence base. We simply many times we continue to administer the drugs. Snyder and others, they say the benefit itself is uncertain. Adverse effects are many, like Parkinsonism, extrapyramidal signs, sedation. So it offsets the advantages in effect of the atypical antipsychotic drugs. The use itself may be restricted to those patients who have few or no side effects, or for whom benefit can be discerned. There are some new approaches which have been made. Amyloid plaques, the amyloid beta, and the tangles of the protein, they are the two important things. The tau protein in the cerebral cortex and the limbic system, it deleteriously affects the higher functions of the brain. So the drugs which inhibit the production of the amyloid plaque, that's the amyloid beta, and the tau protein, like flurazone, they have been used in this particular disorder to decrease the production. The amyloid beta is derived from the amyloid precursor protein. It is partially inside, partially outside cells, and the protease enzymes, the beta acetylase and the gamma acetylase, they carve out this amyloid beta from the amyloid precursors. So neurofibril tangles is another important thing because phosphorylated tau protein is present. More tangles as the disease advances. So they reduce in synaptic density, loss of neurons, and degeneration in the hippocampus. Formation of the tangles continues and it correlates with the severity of the dementia. Then the spice healing, quite often, we common household remedies, we think turmeric, curcumin, and related compounds containing curcuminoids. They possess some antioxidant property. In vitro, curcumin has helped immune cells to degrade the components of the amyloid plaques. That's a UCLA study. And the global incidence, when you think, in 2010, the number of people suffering from this particular disorder were 35 million. In 2020, it becomes 66 million. They have predicted by 2050, there will be 115 million people suffering from this particular disorder. Higher prevalence is seen in Latin America, in Caribbean. So 8.5% of less than US 6.4%, and Naiva Pule in Colombia. There are 23.6% which are more than 60%, 60 years, they are suffering from this disease. That means 1/4 of the population is suffering from dementia in Neva, Colombia. The Antioquia, Colombia, there is a large population where they carry a rare genetic abnormality. There is an increased incidence of Alzheimer's disease, which slow the natural history of the decline. So, craniosimab is a preventive trial to attack the amyloid, this antibody, and to prevent the delay in the development of the Alzheimer's disease. They have tried. They have vaccines. Quite often we talk of the vaccines, any disease. So, to prevent the formation of the beta amyloid by generating beta amyloid antibodies and to reduce the disease progression by facilitating the elimination of the neuron loss. The research itself is in progress. Non-immunological strategy is another way to stop aggregation of the amyloid beta. So to keep the peptide dissolved in the fluid outside the brain neurons, in other words, preventing the formation of the harmful clumps. Alzheimer, which mimics heparin, binds amyloid beta and reduces the peptide aggregation. Some improvement in the cognitive function in mild disease has been seen. The algae-based drug in China statistically improved cognitive function in patients with mild to moderate Alzheimer's disease. They found using an algae-based drug, and the global trials are underway. Don't forget, the target beta amyloid, they does not target the beta amyloid, low molecular weight acid, oligosaccharide extracted from marine brown algae. It acts by rebalancing the gut microbiota, reducing the neuroinflammation and reducing the cognitive impairment. So targeting tau is another way to approach. Because the cause of this disease, there is a neuronal tangle. So the promising target to prevent the degeneration of the neurons is by use of the inhibitors. They could block the kinases that place an excessive amount of phosphates onto tau, but no success has been seen. The reduction of production of the apolipoprotein, the cholesterol-lowering agent, statin. So many times we use one drug and we find some advantage. We are all taking statins to lower the risk of acquiring Alzheimer's disease. This is we are taking because to lower the cholesterol. And it reduces the production of the amyloid precursor protein by lowering the cholesterol. So it has got some additional advantage for the people who are using these statins every day night. The drugs targeting amyloid plaque, like donanemab, it targets amyloid plaque in early Alzheimer's disease. The antibody targets the amyloid plaque, better composite score for cognition, ability to perform the activities of the daily living. Definitely they have shown some improvement. It probably arrests the interaction between the amyloid protein and the tau protein in early stage of Alzheimer's disease. They reduce neurotic plaque binding by 85%. Aducanumab, the human monoclonal antibodies, because these are the drugs nowadays we are all familiar. During COVID, these monoclonal antibodies are being tried. So human monoclonal antibodies also tried on the Alzheimer's disease. It targets the beta amyloid plaque, selectively disperses the building of the amyloid plaques, and it has shown some promising result. Cell-bound therapy, genes encoding a large protein, nerve growth factor, inserted into the skin biopsies from the patients with mild amyloid disease. Such a genetically modified cells, when implanted surgically into the forebrain with the hope of production of this NGF, they are preventing the loss of the acetylcholine producing neurons and to improve the memory. It has been tried. So deep sleep, it is defending against Alzheimer's disease. Recently it was shown, daily the brain cells consume a lot of energy and they produce waste products which include beta amyloid, which you say you are found in Alzheimer's disease. A healthy brain, it cleans them during the deep part of the sleep. It reduces the risk of Alzheimer's disease by practicing good sleep habits. Family support, when we look at the Alzheimer's disease, the most crucial role is from the family. Family plays a vital role in giving support to the patient and to ensure the adherence to the treatment regimens. Psychological support to maintain daily routine, nutrition, hydration, body weight, exercise, hygiene, cleanliness, conditioning, food, and the bowel habits. All these things have to be looked after by the person who takes care. Ronald Reagan, who suffered from this disease, even at the end of the first term as a president, he had shown these signs. During the second time, the condition slowly made advance and completed the term with this particular disease. And he addressed the nation and wrote a letter to the nation on 5th November. Unfortunately, as Alzheimer's disease progresses, the family often bears a heavy burden. Nancy Reagan, who looked after Ronald Reagan during these turbulent days, Ronald Reagan could not identify and call her dear Nancy. He never uttered a word. He never. That's what Nancy Reagan tells. So the behavior and the psychological symptoms are important cause of the caregiver strain. They become exhausted, the family exhausted, the coping reserves, the problem behavior, agitation, aggregation, calling out repeatedly, sleep disturbances, wandering, apathy. So reason for institutionalization of these patients. Quite often people think, but there also it's very difficult to manage these patients. So tips to the caregivers for the daily task. Mayo Clinic has given: reduce the frustration, be flexible, create a safe environment, focus on the individual care, patient and flexibility, along with self-care and the support of the friends and the family can help in dealing with the challenges and the frustrations ahead. So caregivers are the people with Alzheimer's disease. They may experience a vast range of emotions when helping their loved ones. Caregivers may require help from other family members or professional healthcare services as the loved one's condition progresses. Self-care is vital, but often overlooked aspect of the caregiving. Caregivers can prevent adverse health effects from the stress by building a strong support network, protecting their physical health, and pacifying their self-compassion. So the family support itself is very great. So the caregiving by the family is really stressful. People who have seen this one, they can recall how difficult it is. It is a long and arduous task. They increase the psychological and physical distress. But we should not lose hope, not confidence. So remember what Tagore said: if you cry because sun has gone out of your life, your tears will prevent you from seeing the stars. So the medical fraternity is eagerly looking forward for a breakthrough in the research to provide a drug that could effectively slow or stop the gradual loss of the neurons. The treatment targeting alpha beta, the amyloid beta, may halt the occurrence or retard the progress of the Alzheimer's disease. There are certain biomarkers which point out that this particular individual is likely to have the Alzheimer's disease. What are the biomarkers of the neural injury? Raised level of the tau protein in the cerebrospinal fluid, decreased uptake of the 18-fluorodeoxyglucose on PET scan, brain atrophy on the structured MRI involving the medial temporal lobes, paralimbic and temporoparietal cortex. So you find how the normal brain and those with people suffering from disease, the PET scan shows a difference. So the recommendations are: they have to distinguish the spectrum of the Alzheimer's disease during its evolution and have provided distinction between the clinical and research condition. The emerging concept of the preclinical Alzheimer's disease, the role of biomarkers in detection, and treatment at that stage of the disease have implication for the development of the effective treatment. So early symptoms, one has to recognize cognitive and behavior decline, memory loss, especially in areas of learning, recalling new information, language problem in which case one struggles to find the right words, inability to recognize objects and their faces, and to comprehend separate parts of a scene at once, difficulty with reading text, and marked decline in the ability to reason, judge, and solve the problems. We and others, they have said there are 7 warning signs of Alzheimer's disease. People can definitely recognize them. Asking the same question repeatedly, telling the same story word for word over and over again, forgetting hard to do complex things that are used to do without conscious effort, such as cooking or playing games, losing the ability to pay the bills or the balance, checkbook, and getting lost in the familiar places or misplacing household objects, neglecting to bathe or wearing the same clothes repeatedly, but insisting that one has bathed or that unwashed clothes are clean, depending on other person to answer questions or make decisions that one would have made without help in the past. So the tips to reduce the Alzheimer's risk: maintain a healthy weight, eat mindfully, exercise regularly for about 30 minutes every day, as this helps to improve the blood flow to the brain. Keep an eye on important health numbers: cholesterol, triglyceride, blood pressure, blood sugar. Exercise the brain through related games such as puzzles, crosswords, memory, and mental activity games. So the Alzheimer's disease is a relentlessly progressive disease, wiping out memory. Efforts are made to recognize the illness at its beginning. Recognition of the condition with full-blown picture is too late to halt its progression. There are new insights at its early stage. It may help in the intervention with proper therapy. Efforts are made to find remedies to halt the progression of the illness. New insights may lead the way for more effective treatment, targeting at the pathologic process at the preclinical stage. So that's how the brain itself, which was this way, it ultimately becomes in this fashion. So thank you. 50 minutes there.